So how do we evaluate our patients with osteoporosis? Well, one of the things that we can do is a laboratory evaluation. Now, we like to get the bone density scan that looks at how dense your bones are usually at your lumbar spine and your hip, which is the most common place for fractures. However, they're not always covered by your insurance and often have to be pre-certified. So what if you can't get a bone density and you are at risk for it? Well, we do some basic evaluations with the micronutrients that we tested, but there's also a lab called a urine NTX. So it's a test that we can do with the urine collection to see if your bone turnover is higher than your bone building. So we'll see things in this urine test that shows us that your bones are breaking down. If we see that, we may want to get more aggressive with not only just the supplementation of what your bones need to build, but potentially also hormones that can help your bones and or medications. Weight-bearing exercises is one of the best things that you should be doing regardless, and not waiting until you have bone loss. Peak bone mass is in your 30s, and I always recommend weight-bearing exercises, and a lot of women in the middle ages and after 40 are struggling with their hormones anyway. This is exactly when we should be more proactive about preventing osteoporosis with weight-bearing exercises.